Thoughts for Young Doctors. I'm Dr. Freddie Fu from the Department of Orthopedic Surgery, University of Pittsburgh. Every year, more than 20,000 young doctors enter medical school. This is the white coat ceremony at the University of Pittsburgh, where we welcome about 150 incoming students every year. To transform these young doctors into physicians that are treating patients every day, I want to share some thoughts that may be helpful to these young doctors. Do what you love. Steve Jobs, one of the greatest visionaries of our time, once said, "The only way to get great work is to love what you do. If you have not found it yet, keep looking. Do not settle." Mary Poppins once said, "In every job that must be done, there is an element of fun. You find the fun and snap. The job's a game. You have to find the fun in what to do. Having a passion for and enjoying what you do will ultimately pave the way to happiness and self-fulfillment. In the case of medicine, we should be passionate about teaching, research, and patient care. If you enjoy what you are doing, work will not feel like work after all. Mentors. Mentors are a crucial part to your development as a person, especially as a physician. There are many people around you who can help, and you should not be afraid to ask. Identify the best role models that you have at your medical school, who will guide and inspire you in the right direction. Here at Pitt, you will find great mentors, your parents, your friends. Look around, even your classmates you can learn from. The picture here is Professor Albert B. Ferguson Jr., my mentor in orthopedic surgery. You've got friends. Over the past several years, you will develop lifelong friendships with your classmates and faculty. No matter who you are, what you have done, and how you have gotten there will be good times and bad times, high times and low times. Years from now, you will still look to your friends for support. Talking without speaking, hearing without listening. These are lyrics from the song Sound of Silence, which was released by Simon and Garfunkel back in 1966. This is critical to develop good communication skills. This includes the ability to listen, reflect, and empathize with your patients and colleagues. I have always admired Mr. Rogers, who was from Pittsburgh. I actually live in Mr. Rogers' neighborhood. Mr. Rogers had the remarkable ability to communicate with people of all ages, including children. We should all take a little bit of Mr. Rogers in ourselves. Focus versus multitask. When focused, one can feel attentive and diligent. Multitasking is capturing what is happening around you, plus what you are concentrating on that instant. This is a unique talent given to less than 1% of individuals. In reality, multitasking is overrated. Being highly attentive to one test at a time may be the most practical skill to emphasize, especially in patient care. Focus and be efficient. IQ versus EQ. Both IQ and EQ are crucial to healthcare delivery. Intelligent quotient, or IQ, allows for in-depth analysis of patient data, as well as narrowing diagnosis and treatment options. EQ is what we call empathy quotient or emotional quotient. It is the means by which we connect with those around us. In the physician-patient relationship, a high EQ establishes an immediate connection, which then allows for an honest, trustworthy, and productive exchange. FaceTime. We live in a digital world today. As a result, this may provide us with a false confidence that no direct contact is necessary to achieve our objective in medicine. This could not be further from reality. In medicine, especially in patient care, we must talk to our patients. This is one critical area in which human interaction is essential. Facing a computer and typing into a computer does not help. Speaking to the patient and family face to face, being an active listener and observing their general appearance led to a new revelation. Beyond this, FaceTime connects a patient with a physician as a trustworthy, capable, candid, and compassionate caregiver. For better or for worse, in medicine, we are committed to a profession by its own design and nature, mixes grief, joy, and sadness, as well as moments that make us rejoice. Like a good marriage, we're in, quote, for the better or for the worse, unquote, to the ultimate benefit of the patient and our profession. Does no difference really mean no difference? Dr. Jim Yong Kim, now the 12th president of the World Bank, once said on healthcare delivery, we are making the same mistake in global healthcare that we make in the American system, believing that better diagnosis and therapeutic tools will solve all problems. They will not. They haven't. We don't measure results well enough. So we need a better outcome measurement, and we have provided with all of you with a unique opportunity to be critical of our evaluations tools and find differences in outcome. When you hear the phrase no difference, challenge it. Set a high standard for yourself and for your profession, and look for the best outcome for the patients. Is evidence-based really evidence-based? The phrase evidence-based medicine is one that you will hear time and again throughout your medical school career and for your whole professional career. Evidence-based medicine was developed at McMaster University by Professor Paul Guyette in 1992. This approach utilizes the clinical expertise of the physician, the values and expectations of the patient, along with the best clinical evidence to improve patient outcomes. The very concept of evidence-based medicine is based on how a study is designed, However, the process of data collection and analysis is just as, not more important. We must meet the fine print, especially in case of conflict of interest. They can bias the results. Is the latest always the greatest? Innovation is a critical aspect to advancing healthcare in our society. However, in so-called the business of medicine, many times a product is being marketed to the medical profession and public. In my field of sport medicine, we have seen this scenario many times when a product is used by a famous surgeon in a professional athletes. In the 1950s, a drug called thalidomide was developed in Germany and marketed as a sleeping pill to help cure morning sickness in pregnant women. It took almost 10 years to realize that this drugs caused severe physical birth defects in children, which included being born without ears, arms, or legs. Unfortunately, the latest is not always the greatest. It is vital that vigorous scientific investigation take place, with both positive and negative results reported. This includes complications, and of course this has to be confirmed by independent investigators. Do the right thing. My mentor and former boss, Professor Ferguson, once said, just do the right thing. Take good care of your patients, and they will take good care of us. This sounds like such a simple concept, but yet in reality, it is not simple. Doing the right thing is a summation of everything that you have learned throughout your life and training. Every decision you make should be for the betterment of the patients. Credibility and integrity. Now, everybody is here in the Waco ceremony, and definitely you are very credible. However, to create this credibility is not as simple. As a medical profession, you will always have credibility in the public eyes. Upholding this credibility requires you to maintain integrity and be free of conflict. This is not a simple task. You must do no harm and give your best to the patient. To quote Albert Einstein, only a life lived for others is a life worthwhile. In the field of medicine, the patient should be first, second, and third. Be a dreamer. Each and every one of us should continue to dream, big or small. But dreams don't always come true. And in those cases, we cannot become discouraged. Stay hungry. Never stop dreaming. Don't be a dinosaur. It is human nature to stick with what makes us feel comfortable. However, innovation, medicine, and continuing to improve the lives of our patients does not allow us to sit still. I challenge you today to renew yourself constantly. Challenge yourself and others around you, constantly learn and improve for the betterment of the healthcare and our society. The world is flat. In 2005, Thomas Friedman authored an international bestseller titled The World is Flat, A Brief History of the 21st Century. There's an important point to be taken from Mr. Friedman's analysis of globalization in business, which is that all competitors have an equal opportunity. This also holds true in the globalization of medicine too. Regardless of your gender, ethnic background, or religion, each and every one of you controls your own destiny. In a global profession, we must speak the language of others and understand their cultures. Healthcare delivery is not just an issue here in the United States. We live in a globalized world. Healthcare is a global problem, whether it's AIDS, Zika virus, it's all our problems. Terrible Towel. Myron Cope was a legendary American sports broadcaster and the voice of the Pittsburgh Steelers for 35 years. Before a playoff game in 1995, Myron came up with the idea of a terrible towel, which is woven in the Steelers colors of black and gold. It was simple and for the fans to carry into the games when waved was meant to intimidate the opposition, particularly when upwards of 65,000 fans in our stadium in Pittsburgh. The terrible towel remains one of the most recognized symbols in professional sports anywhere in the world. Something so small, only worth $10 or so, but before Myron Cope passed away in 2008, he quietly left the rights of the towel to Allegheny Valley School in Pittsburgh, which is a nonprofit agency caring for children and adults with developmental disability across Pennsylvania. Steelers fans continue to wave it proudly, and the school has received millions of dollars from its sales. No matter how big or small, giving back to your community, your school, your area is important. It does not have to be money. It can be your time, your talents, or idea. I encourage everyone here to find one simple way to do so. Home sweet home. Home is the most important base that you will have reaching out to your profession. You can never replace your family. Remember all the birthdays, anniversaries, athletic and other school events. Spend time with them. This should be always your number one priority. I never dared to be radical when young for fear it would make me conservative when old. Robert Frost. There was a line written by Robert Frost in 1936 poem titled 10 Mules. Frost was an award-winning American poet. Life is like a pendulum. Don't make a radical decision early on in your life that will come back to haunt you later. As my mentor, Professor Ferguson, told us at his 90th birthday celebration, take the middle road and don't do something too crazy. Respect the past. In this picture taken in 2010, I was standing tall with some of the greatest medical professionals in the University of Pittsburgh history, including Thomas Stasso, liver transplant pioneer, Bernie Fisher, pioneer in breast cancer surgery, Julius Younger, who together with Salk invented the polio vaccine, and many others. If you respect the past, then you will learn how to navigate into the future. So embrace the future. The future is bright in medicine. There are many good things that we can help the patient with. Lastly, learning is forever. This is the Cathedral of Learning at the University of Pittsburgh, built in the 1920s. Every day when I pass by, I take a picture like this, and every time you pass by this, remember that learning is forever. I can tell you I learned from my trainees, my students, and my colleagues. And I also learned from people from all over the world. With that, I want to congratulate everybody to enter a wonderful profession, and good luck in your career. Thank you very much.